Well, hello everybody. Good morning. We want to welcome you to this webinar. We want to thank you for participating in advance. And this Zoom is part of City Hall's ongoing effort to communicate with the business community. Today we're focused on the personal care segment of our economy. My name is Eric Dysart. I'm with the City of Pasadena in the City Manager's Office. And we know that there's a high level of eagerness to get the economy going again. And we all have had struggles with the information that's coming from the state, from the feds, from the county, and we know that can be confusing. So we want to make sure that we provide an up-to-date kind of set of bullet points for you, and also engage in a conversation. So we want to make sure that you have a chance to ask questions. You could do that by raising your hand in Zoom, or also using the chat function. And we'll try and get those to those questions at the tail end of this hour webinar. We will have others from City Hall participating. I'll introduce those in a moment, but I want to at least acknowledge that this has been a very serious health issue. We have over 48,000 cases in LA County. There's over 1,200 new cases every day. 30 or more people have been dying each day. So that is a very serious kind of set of circumstances that we need to get past. And but luckily, the good news has been we've been able to stay underneath the kind of hospital capacity. So that's why there's a kind of a slow trickle of new news coming out of the state on which segments of the economy can open. So to kind of get through the details associated with personal care, so I know it's kind of a broad category, but it's probably going to lean a bit more towards salons and barbers today. I know there's other tangential uses associated with that. But we'll start off with our health department, represented by Manuel Carmona and Rachel Janbeck, who are going to step through a series of slides, and hopefully that'll start the conversation, and then we'll open it up for a question. So with that.
Yes, good morning. Thank you. I appreciate the opportunity to be here with everybody this morning. Manuel Carmona, Deputy Director for Pasadena Public Health Department. To set the foundation and give some context for the conversation this morning, we thought we would give an overview of the California State Roadmap for Recovery. And let's get that loaded there. Okay. Next slide. So many of you have been hearing about these 6 indicators. I'm not going to go into them in great detail, but just to know that these are the indicators that the state and the governor are looking at to indicate whether or not there's been sufficient progress for navigating through the stages. And so this is the roadmap, so to speak. Next slide. So the roadmap stages, there's 4. We're currently on the low risk stage 2. There are certainly some things that are changing in stage 2, and we continue to look at new business sectors seems like every week or possibly even days. The state is easing restrictions. And so we're currently in stage 2. What we are allowed to do, as I mentioned, the governor is evaluating those indicators. As a state relaxes the restrictions within the stage, we're able to, at the local level, determine whether or not we can ease restrictions on the business sectors. Now, if the state relaxes restrictions in the current stage, we can go as far as the state will allow us, but we can also make stricter rules. We, at the local level, are trying not to do that. We're trying to open up as quickly as we can, but we cannot ease the restrictions before the state unless they approve what's called a variance to the readiness criteria. So let me give an overview of what that criteria is. Next slide. There's a total of 15 different criteria and 3 different categories. And again, I'm not going to go through all of these in detail. I just wanted to show you exactly what we're working with here. But the categories are case metrics, preparedness, and then response capacity. I'm happy to talk or answer any questions that might come up if folks want to do a deep dive on that. Next slide. So how does a request for a local variance happen? So the county, through their health officer, is the only individual that's allowed to submit a variance on behalf of the local health jurisdiction. The state has interpreted that the counties are only eligible to apply for a variance. And so at this time, they've informed the city of Pasadena that we cannot pursue a variance. Nonetheless, we're contesting that interpretation and seeing if we can submit a variance so we can move more quickly at the local level rather than waiting for the county. Now, to pursue a variance, the county health officer has to attest that all of the 15 state criteria have been satisfied. And we know that here locally in Pasadena, there are several that we don't meet, but the trend is improving, and we feel that we're encouraged by what we're seeing. Now, once a variance is submitted to the state, if it's approved, then the state will allow the local entity to move more quickly through the current stage only. So if you remember the stages, we're currently in stage 2. We would not be allowed, if approved, we would not be allowed to move into stage 3 or stage 4. And so it's important to note that. Now, there are some consequences if we decide to move forward without state approval, and that is that the state can actually suspend our eligibility for funding for a variety of programs that extend beyond the pandemic response. Next slide. So I wanted to end this part of the presentation by just talking a little bit about where you can find more information about the California roadmap, the stages and the variance criteria. There's a website there, but I also took a screenshot of the state website that shows that at this point in time, the hair salons and barbershops are not allowed to be open statewide. And then it gives a list of additional business sectors and establishments and activities that are also restricted. And I know this is a very difficult time for our community. We want everybody to know that we are doing everything that we can to evaluate the risk for our community and see what we can do to open up these big business sectors as soon as we can. So with that, I'll end my presentation and see if Rachel Janbeck, our Environmental Health Services Division Manager, has any additional comments.
Thank you, Manuel. Hello, everybody. I'm Rachel Janbeck. I oversee the Environmental Health Program for the City of Pasadena. One thing that we've been working on diligently over the last few weeks is developing guidance for businesses as the state allows the businesses to reopen, to provide them protocols to follow to operate safely. And we're excited to develop a checklist for salons and barber establishments, as well as other establishments like gyms and tattoo parlors, as soon as the state provides that guidance and moves closer to reopening those businesses. Just this week, the state did release guidance for salons and barbers, and it's posted on their website. That guidance is it's guidance that, as a local health department, we can implement at the level that the state recommends, or as a local health department, we can make stricter guidance here in the city of Pasadena. But we're choosing to follow the state guidance and not put additional restrictions on our businesses. Now, I'm going to speak a little bit more about salons and barbershops because that's the guidance that we're currently working on, and that is the business that will likely reopen next as far as personal grooming services, or that's what we're hearing the state may be moving toward. And many of you have probably heard that salons that are opening in other states and other counties here in California even were required to reduce their occupancy to 50%, or in some instances even 25% of the clients that they would normally see. In Pasadena, we are not asking you to do that. In Pasadena, we are not asking you to reduce your occupancy to a certain percentage at all. Instead, your capacity for the number of stylists and clients that you will be able to have in your facility will simply be based on the size of your facility and the ability for the workstations and the stylists to remain 6 feet away from each other while they're doing their work, and of course from each other's clients as well. And of course, that 6 feet distance doesn't apply to the stylist and their own client. Now, the state has been very clear that when salons and barbershops reopen, that the reopening will apply to a certain type of procedures only. So they will allow, when they move to reopen, they will allow haircuts, weaves, extensions, braiding, lock maintenance, wig maintenance, and hair relaxing treatments and color services. But other services that salons typically provide that involve touching a customer's face, such as eyelash services, eyebrow waxing and threading, and facials, will not be allowed when salons first reopen. This is a state requirement, and we are not allowed to be less strict than this. Some of other highlights from the state's requirements that we will have to implement in Pasadena are that stylists, barbers, and employees, as well as clients, will need to wear face coverings. And of course, we're recommending the face coverings that just loop behind the ear so that you can still cut and wash hair. Salons and barbers will have to post signage regarding the requirements, and also reminding clients that if they're ill or they have any symptoms that are symptoms associated with coronavirus, that they should postpone their appointment for 14 days. The state is requiring that all services are by appointment only, and that walk-ins will not be taken, and that stylists do not double book clients, so that when a stylist is working with a client, they're only working with that one client from the beginning to end, and then they leave enough time between clients to disinfect the space before the new client comes for their service. Finally, the salons are going to be required, the state is requiring that magazines and items such as complimentary coffee are temporarily closed or removed at the time that the salon reopens. Those are just a few highlights. I wanted everybody to be aware of what's coming. The other big part of the guidance includes disinfecting and sanitizing of the facility, but we recognize as businesses that are licensed by the Board of Cosmetology, this is something that you do every day and that you already do very well. The barbicide and the other disinfectants that you normally use in your facility are effective against coronavirus, and so you will just be asked to continue to follow those guidelines from the Board of Cosmetology. That's my presentation.
Great, thank you, Rachel. So there are several things we didn't have a chance to touch on, but we want to maximize the time that we had to respond to questions. I know there are lots of specific items that participants might want to kind of get more detail on. So again, as a reminder, go ahead and raise your hand in the Zoom meeting or use the chat function. And if you are on the phone, you need to use *9 to raise your hand and *6 to unmute. We also want to make sure that we make this point that this is the business briefing and is off the record for the media. These comments are kind of made directly from the business owners to city staff. And so if there are any members of the media on this call, we ask that you jump off. So with that, I have some assistants in the room to kind of shout out some questions, and we'll combine those with going to those that raised their hands. So, Michelle, is there a first question?
Great. Could we first go to Debbie M. for your question?
Debbie, go ahead and unmute yourself and ask your question.
Yes, Michelle. Concerning to me is I own a personal training studio. We are one-on-one. It's myself and another trainer, and we have about 2,000 square feet. We are nowhere near our clients, even pre-COVID. We maintain a distance anyway. We're not hands-on. And these briefings seem to really, or this briefing in particular, we don't touch our clients. We are far away. We can wear masks. We have great ventilation. In a space like mine where we have ample space, we're actually planning on alternating days. So I'm only in there with my client on certain days. The coworker's in there with her client on other days. So we'll alternate morning and afternoon. We'll sanitize and do all that. I don't see how a retail space can be at 50% capacity where I can't even have one person in a 2,000 square foot facility where we are wearing gloves and masks and not having any crossover of clients and disinfect. It doesn't seem like we should be anywhere in the same category as hair salons, nail salons, masseuses, personal services where they actually are hands-on and very close. So my concern is that we're going to have to either wait for big gyms to open, which we shouldn't be in that category. We shouldn't be in the category where people are doing multiple people in one room, say 10 people in a fitness class. It's a very specialized category, and I'm afraid we're going to get pushed to the very end when that isn't necessary.
So thank you for your comment and question. I know that's been a frustration. There's such a wide variety of facilities like yours that are smaller and more boutique, but at this point in time, the state is lumping them together with the kind of caution of people exerting themselves in close contact. So right now, we still see that as a phase 3 type of activity that the state is contemplating for opening. And yeah, we're sympathetic to that kind of broad brush that they've made so far. Yeah, so it's phase 3, and Rachel, I don't know if you have any other comments about that. I know there's between the personal training and yoga and a few other things that are kind of in that same direction that seem to be more manageable in smaller spaces, but as of now, there's no differentiation. Rachel, do you have a comment on that?
Just to say that I think that it's a really good question, and I think that there's an opportunity there to take the information that you're providing and show that there are different levels of fitness facilities, and perhaps present that in a way to the public health officers and the state, and see if they would be willing to categorize them for different levels of reopening. But and I'm willing to share your comment in that way. But as far as like what we have to do right now, we have no choice but to follow the state, and right now the state has all of the gym and fitness activities lumped together.
For folks, we're getting a lot of questions of this nature. For folks to contribute comments for consideration to the health officer, what would be the best way to do that?
You know, I can collect comments related to fitness facilities through the general environmental health email address, and I'll say it now. Everybody can write it down. It's envhealth@cityofpasadena.net.
Thank you, Rachel.
So our next question is a call, or it's actually one of our listeners raising his hand, or his or her hand. It's Persignate. Go ahead with your question.
Go ahead and unmute yourself, Persignate.
Oh, got it.
There you go. Go
Hello.
ahead.
Hi, yeah. So my question is just for barbershops, because I heard you comment about not touching the faces. Like as far as facials for hair salons, we touch faces when it comes to beard trims and straight razor shaves, hot towel services. Does that fall in that same category?
Yes.
Yeah, so I can answer that. In reviewing the state guidance, it says that any service that requires touching the face will not be allowed to reopen when the salons reopen initially. And so because the state has set that rule, we would have to also follow that here in Pasadena.
So one question that I wanted to pose that we didn't maybe highlight enough in the early presentation was just when this is going to happen. And the quick answer is we don't know yet, but we are hearing rumblings just with our health office working with the county that it might be a matter of days and even as potentially as early as this weekend when we're going to hear from the state if they approve the county variance that's been submitted. So it's speculative. We wish we had a definitive answer for this group participating today. But at this point, it certainly feels like it's not weeks off or even potentially less than 2 weeks, less than 1 week, hopefully, even this weekend. But again, we're just kind of maybe being a bit too enthusiastic ourselves, hoping that's the case. But it is possible. So we expect that there might be a chance for the state to respond to the county's request this afternoon. Perhaps it's tomorrow morning. That's, I think, the best we can do on the timing question that I can anticipate several people kind of queuing up on. So with that, is there the next question?
Sure. Let's go to Ricky Ariano. Go ahead with your question, Ricky. All right. While he or she is waiting, can you speak on businesses that are by appointment?
Can you hear me?
And offering stretching services, saunas, as long as social distancing, masks, and other measures are met. Also, what about massages if avoiding the face? So they're asking if this business that offers a stretching service, single occupancy sauna with social distancing, and massages that do not involve touching the face.
Okay. From my understanding, when we look at the state guidance today, and I want to be clear that the guidance does change, but when I look at it today, it looks like a majority of personal care services, including massage, tattoo, microblading, those all will open in stage 3, and we are in stage 2 right now. But it appears that the state is considering a move to allow hair salons and barbers to reopen early for the variance counties. Those are the counties that got permission from the state to move ahead of the reopening process. And that LA County is seeking a variance, and if they are approved for the variance, then just those particular business types would be able to open in LA County, but not the other personal care services until later.
So would estheticians be able to perform body waxing under the current order?
The guidance isn't clear, so I'm not able to answer that question.
Is Ricky available? If not, we'll go to the next person. Ricky Arellano.
I'm here. Can you hear me?
Yep.
Hello? Can you hear me? I'm sorry.
Yes, you can.
Go ahead and ask your question.
Okay. So we are a med spa. So we are concerned about doing injectables on the face, lasers on the face, or are they going to be restricted to body treatments only?
So right now, the state hasn't put out guidance for laser services, and I don't think that laser services will be reopened when salons are allowed to be reopened in the various counties. So we're waiting for the state on that guidance, and that's a good question. I don't know the answer yet.
Okay, and then what about injectables? Like Botox or filler?
Are you licensed by the medical board to do injectables?
Yes, we are.
I think that you would need to ask them regarding when you'll be allowed to reopen. But my understanding as of today, that anything that is elective, such as injectables, is not allowed to open.
Okay, thank you.
And I'm sorry I don't have more information for you. Some of these things, we know they're coming in a later stage, and so the state is prioritizing the particular guidance as far as like the details of how to operate for what's coming next. And so I think that we'll have more information in a week or two on some of the business types that you guys are really curious about.
Thank you, Ricky. We're going to go to Maria Jimenez. She's raising her hand.
Hello, Maria.
Go ahead and ask your question, Maria.
My question was really in regards to the first gal who called in regarding fitness. We're a Pilates studio, and it's been pretty standard in our industry that we have been ahead of this game. Nobody sits on a piece of equipment without it being sanitized in between. Our equipment is spaced 6 feet or more apart, and so wearing masks and taking, the more precautions than we're already taking, it really does seem unfair for all of us to be lumped into the gym category when we're not a gym. We are really more personal care. So, thank you for addressing that. But we really do need to be in a completely separate category, because how can a restaurant have people sitting in a restaurant? And I would think that is more a higher risk than what we provide. We're 1 or 2 people in here. We don't hold big classes. We have maximum 3 people in a class, sometimes a couple more, but that's it. So, we really need to have some kind of variance or exception for these boutique industries. And that's it. And thank you for giving that address for us to submit, and any other helpful information you can give us would be great. Thank you.
Thank you for your question. And again, we want to hear those types of comments, and we appreciate the fact that you have such a diligent cleaning habit, previous to this COVID emergency. So those protocols will be specified as this next phase gets closer to us, and they do allow those gyms and Pilates studios and yoga studios to open, and perhaps there'll be some finding between now and the full phase 3 that the smaller ones, the boutique ones, can open, but we don't have that information at this point. We'll go to the next question.
I have a two-part question in the chat. The first is, do you have any idea on how long or how much advance warning businesses will receive before reopening salons? And then the second part is, are businesses protected by city ordinance if any lawsuits occur because of COVID-19? So maybe, Rachel, could you take the first one about advance notice, and then Eric, lawsuits?
So at this time, we're waiting for the state to respond to a request from LA County to see if we're allowed to reopen some of these later stage type businesses. And when a response is submitted, the reopening process can happen very quickly. And I know that we've seen this happen with other business types as well. We will try to give our businesses as much notice as possible, but it may be a day or two notice until you'll be able to reopen. And it's just because we are trying to get you the information and the guidance as quickly as we get it.
But before you open, those protocols do have to be in place as far as having the checklist, having accomplished some of the distancing requirements between the chairs, as Rachel mentioned before, making sure that people are not waiting in the waiting room, that it's by appointment only. So those are all things that you'd still need to have in place before the first customer walks in the door. Yeah, the actual announcement can be pretty quick, and we do recommend that those of you who are participating today, that you sign yourself up for a direct email from our newsletter, so that as soon as we have the information, we can send it out. But I can imagine something like this being announced on television pretty quickly too, if the county gets that variance approved. And then the question related to the kind of legal side, I'll just give a kind of very broad kind of perspective from this staff member, nothing official from the city. But that's one reason why the protocols are so important. Those are carefully laid out so that they are providing the cleaning protocols, the distancing protocols, the operational protocols to protect your employees and your clients. So, and you need to kind of go through that carefully, have that on file. You need to make sure that customers have the opportunity to see that your employees have a copy of it, and that we, with all that being in place, we feel like legally everyone's going to be on solid footing when it comes to the whole wide range of crazy issues that can kind of develop out of this. But that's why we want to make sure we're taking this seriously. Okay, hopefully that's not too scary, but we'll go to the next question.
Great. Can we go to Morel Roman? Go ahead and ask your question.
Hi. I am a solo esthetician, so I just work by myself. And I think my question was already answered regarding performing body services.
Right.
Yeah. So I guess that's you guys don't know yet where body.
No, we don't, but we are tracking your question, and we'll try to do some follow-up. Perhaps following the webinar today, we'll get your email address and send something back to you. With that, we're going to go to our next caller. This is a dial-in listener. Their phone number is 323-842-5820. Go ahead and press *6 to unmute yourself.
Thank you for taking my call. Can you hear me?
Yes. Go ahead.
Okay. So I fall under a salon suite, and I'm a nail technician. So my question would be, I understand that the salons will be opening as far as hair and barbers, but I was wondering when will the nails fall into place as far as the guidance is allowed? I know we have to be 6 feet apart, And I have another question as well as, how long do you think we should take to disinfect in between each client, especially as a nail salon? I'm one solo operator, so it's just me and one person. And state board ordinance for us would be 10 minutes for disinfection with barbicide. But I want to know, should it be a little longer for the air to be able to clear, so that way when we bring in another person, the time lapse between all of that is in a more sanitary ordinance for the city?
Yeah, that's a great question. Rachel, do you want to cover that?
Sure. I'll answer the second part first, which is the time for disinfecting. It's really important that when you select a disinfectant to use, whether it's the barbicide or it's a disinfectant wipe that you're using to wipe the surfaces, that you read the label and then you follow the label instructions. The label is always going to tell you that there's an amount of time where the surface needs to remain moist with the disinfectant, and that's called the contact time. And the surface needs, and usually contact time for surfaces is about 60 seconds. You need to read the label for the particular product that you're using. And then for the barbicide, the same. There's no reason to disinfect longer than what the label says, because the label is effective. The label instructions are effective. And then your question about the air, we are encouraging all of our different business types, if you have the ability to open a window or prop a door open to let fresh air in at any point in your business, and I know that some businesses can't do this, but if you have the ability to, it is recommended. It dilutes any virus that might be in the air, and it causes the air to flow through. Some state guidance also recommends, increasing airflow mechanically if you have that ability, as far as with like a filter and a fan or air conditioning unit. To answer your first question about when you'll be able to reopen, that is a question we all want an answer to right now. So right now the state has nail services categorized with the other personal care and grooming services, such as fitness centers and tattoo parlors and massage establishments. And that's in stage 3, and we haven't been provided a date yet, but we're watching closely. And as soon as we know, I think that we'll be able to share that information.
Thank you, Rachel. I have 3 salon-related questions for you. One is just confirming that both stylists and clients need to wear face coverings. Is that correct?
Yeah, I'm happy to touch on that more. Both stylists and clients are supposed to wear face coverings. There are some exceptions. There are persons who are, they have medical conditions that wearing a face covering would make it dangerous. Wearing a face covering is dangerous for them. And then we never recommend face coverings for children under 2 years old. And so if you have a client or an employee who meets one of those categories, then a face covering would not be required. But for everyone else, it is.
Great, thank you. Another question came in about a shared salon space. Can they install Plexiglas where they cannot separate 6 feet, like within a shampoo area?
Yeah, I understand it might not be too difficult to move a chair 6 feet away from another chair, but it's much more difficult to move a sink because it's plumbed. And you have a few options. You can close every other sink, or you can install a barrier between the sinks, just like we're requiring for, I think what's going to be required in other business types like restaurants, a barrier between booths, because you can't move booths either. And so that barrier needs to be cleanable. It can't be a curtain. It needs to be something that you can spray with the disinfectant and wipe down. So a lot of people are recommending or using Plexiglas, but something comparable to that would also be acceptable.
Great. And then the third question relates to blow-dry services. As far as salon services go, can they provide blow-dries after a haircut, or is it just blow-dry services?
The way the state guidance is written, there is not a restriction on blow-drying.
Okay. Thank you. Let's go to one of the folks that has raised their hand, Stephen Witt. Could you please go forward with your questions?
Hello, Stephen.
Hi, it's Steven, actually. I just want a list of the guidelines for opening a salon. You put up a website, but I went there and it really doesn't have it.
Yeah, I can answer that. In Pasadena, we haven't posted the salon guidelines yet because we're developing them right now. But if you want to get an idea of what they're going to look like, in many ways, they're going to match the state guidelines. And so you can get a sneak peek at what our guidelines will look at by going to the state website and reviewing their guidelines. And the state website is covid19.ca.gov.
So when Pasadena issues its own draft guidance and checklist, does that supersede the state website, or should people be looking at both?
Pasadena, people should be following the Pasadena guidance. The Pasadena guidance will be aligned with the state guidance, but might be a little different in some ways, possibly more strict, but always aligned, and so the Pasadena guidance should be followed.
Great. Thank you, Rachel, and thank you, Stephen. Let's go to Glen Mitchell. Glen, go ahead and ask your question.
Thank you. Thanks for doing this, and these are fantastic questions. We run a tutoring service. We typically provide service in-home, but we switched to online for now. In terms of guidelines for providing service in-home, what stage or industry category should we be looking at for guidance? Is this the correct category, personal care? And then just a follow-up to that as well, we have a lot of the same one-on-one issues that say fitness, personal fitness studios have, and things like that. But we also have this issue of in-home versus in a facility. We have an option for providing services in our office. What category would that be?
That's a good question. So give Rachel a moment to think about it. So give us a little bit more detail on the exact kind of service you're providing in-home.
Yeah, so we provide educational services where there's one tutor and one student. Typically, they do that at home. The tutor travels to the student's home and works with the student. We sometimes provide service in our office where both the tutor and the student meet at the office. Currently, we're providing all of our services online.
Okay. But it's academic. It's instruction, not
right, academic tutoring.
Okay. You know, there's so many business types that are so specific, and I don't think that the broad state guidance has clearly stated where your type of business will fall in the reopening process. I haven't seen it on the state guidance. So I'm sorry I'm not able to give you more information on that right now. But if I'm hoping that we'll be having this call again with this particular industry group, and that I will have a lot more information the next time we meet.
Thank you. We have another caller, or both a chat question and a raised hand from Fight Academy, Pasadena. Go ahead with your question, please.
Good morning, Fight Academy. If you're on the phone, go ahead and hit *6.
So we do have somebody who's asking if we can send all of the protocols to every business with an active business license in Pasadena.
Can you?
All right, go ahead. We'll start with Fight Academy.
Okay. My question is, will there be any type of exemption or any type of breaks on our business license fees? You know, we're going to be operating at a smaller capacity. We've lost a lot of clients. We've lost a lot of revenue. So are we going to be expected to maintain the same level of, what we had to pay as far as to operate in Pasadena? Is that going to, or will we get some sort of, or is it possible to get some sort of exemption from the city, in conjunction with what's going on with COVID-19?
So our finance department isn't with us today, and previously they advised that the renewals through the end of June have been extended, and that they would likely reevaluate this with City Council as a policy discussion.
And that's on the business license, but there are other kind of fees when people are trying to request permits for adjusting maybe walls, and that discussion is being had at City Council to provide some relief to businesses who are trying to get up and going again. But And then on the parking side, the city's relaxed parking standards for 20 minutes. So we've tried to work around a few ways. Many businesses received, or utility customers received a rebate that went out last month for a partial rebate on the utility cost. So the city's been trying to work around that issue, but it's not across the board on all kind of fees that you might be responsible for.
And in addition, City Council has waived all penalties and late fees.
Right.
All right.
Good question.
Let's go to another hand raised. How about Cindy?
Morning, Cindy. Hi, Cindy. Go ahead and ask your question.
I don't know how to unmute.
We can
You
hear
are. You're unmuted.
And okay.
Go ahead and ask your question.
I own a nail salon in Pasadena. So is it considering reopening the same with the salon, the same time with the salon? Yeah, my question is that.
Okay, so we heard in the nail salon question. So right now, that is not anticipated to be soon, or as far as at least the next few days. That's part of the phase 3. So that's still several days or weeks away. The more immediate change that we're anticipating is focused just on the hair. So for barbers and salons that are not touching the face directly, or the nails or pedicure. So right now, that's the more immediate reopening focused on, again, hair salons.
Great. Thank you, Cindy. Let's go to Lo.
Good morning, Lo.
Hi, my name is Laura.
Laura, all right.
Can you hear me?
Morning, Laura. Yes, go ahead.
Hi. Okay. My question is again about with the plexiglass. I'm in a shared space and some of our stations are not 6 feet apart. And if we remove a chair, it's going to really affect the amount of people we can have working. So if a plexiglass is installed, will that mean that we don't have to be 6 feet apart?
That's a good question. Rachel, you want to take that on? The plexiglass, I'll just say this in the meantime, that's the common material because it needs to be washable.
Yes.
There might be other options, but as far as the distancing, Rachel has that response.
Sure. So the state is requiring that, I understand your question, but I want to start all the way from the beginning. So the state is requiring that the stations are 6 feet apart, and clients are 6 feet apart from other clients, and stylists are 6 feet apart from other stylists. That's the best practice. And in order to achieve that, they're asking that every other station be closed if it cannot be spaced out, or that stylists come in on staggered shifts so that they're not all working at the same time. There is an allowance to use a barrier in some instances where spacing is not possible. I think it would be very difficult to get enough plexiglass to fully separate the stations, but I don't want to say that it's not possible. I just think that it would require quite a bit, but I think it's possible.
So I have 2 questions coming in through the chat about paperwork. The first is, the first question is, do businesses need to send protocols to the city? What do they need to do with their protocols? Mm-hmm. And then the second one is asking whether or not clients also have to fill out any sort of COVID questionnaire for symptoms history.
Okay, good question. So, hair salons and barbershops, we should have the public health reopening protocols posted on our website within a week. It doesn't necessarily mean that you'll be able to open. We do have to wait for the state's approval, and we don't have that now, so I want to be really clear about that. But when the state does approve it, that activity in LA County, you will have to complete the protocol checklist. It's several pages long. You check everything off. Make sure that every stylist, every employee gets a copy of the completed checklist. Post a copy of the completed checklist in the business, and then implement everything that's required on the checklist. And once you've done that, you can open. You don't need to submit your paperwork to anyone in the city, but you have to have it. You have to have gone through all those steps. Now, if the city receives a complaint that the protocols are not being followed, the process for us investigating the complaint is the first thing we do is we go out and we ask you to show us your checklist. So you do have to keep it handy. And upon request, you might need to provide it, but not as a condition of reopening. And what was the second part?
Do clients and customers need to fill out any sort of symptom questionnaire?
So everyday stylists, barbers, and staff need to self-screen for symptoms. There's no requirement that somebody take every employee's temperature before they come to work, although some can choose to do that. Instead, you can just ask every employee and every stylist to report verbally that they are not experiencing any symptoms, or report on an app or by text or an email, or fill out a checklist. You get to decide what works best for your business. As far as clients, we're asking that you do a few things. That when you make the appointment with your client, you let them know that as it gets closer to their appointment date, if they are not feeling well, that they need to reschedule their appointment for 14 days out. Now, a lot of our salons will reach out to their clients maybe the day before the appointment to remind them of the appointment. At the time that you reach out to remind your client of the appointment, you should also remind them that if they're experiencing any symptoms, that you'll need to postpone the appointment for 14 days, and remind them that they should come with their face covering. Finally, when the customers walk into the salon, they should see a sign posted at the entrance that says, if you are experiencing any symptoms of coronavirus, then you must not enter, and you must postpone your appointment for 14 days later. So there's several ways that we're communicating with our clients regarding that requirement, that they don't come visit the business while they're feeling ill. But it is optional for you to screen them when they walk in. You can use either process.
Great, thank you. Let's go to one of our dial-in callers. Their phone number is 323-479-5998. Go ahead and press *6 to unmute yourself and go forward with your question.
Hi, can you hear me?
Yes, go ahead. Go ahead and ask your question, sir.
It's not really a question. It's more really, hi, I'm Alex, by the way. I own a hair studio here in Pasadena. And it's not really a question, it's more a comment, and I might be in the minority here. But I feel that it's too soon. There's a lot of things that we need to do before, after, during, and for us to do our job effectively, we need to be in our client's personal space. There's no way about it. So for me, it's a concern because I'm putting everybody's health in the hands of somebody else. I'm praying and hoping that the client doesn't have symptoms. I'm praying and hoping that they didn't go to a party the day before. And you know what I mean? So for me, I just feel, why can't we just stay at home order for longer and just let this ride? I mean, we are a luxury industry. We are not an essential business. Like, this is a luxury for people. It's not a necessity. And right now, we just need to think of everybody's health and not just the wealth. You know what I mean? And it's really upsetting, and it's concerning to me because now everybody, even the questions that have been asked now, they're kind of, it's self-explanatory, and people are still asking, can we not stay 6 feet? Can we just put a plexiglass? And it's like, I have a feeling that people are not going to be doing what they're supposed to be doing in their closed environment, and that's going to do another outbreak. I mean, I don't know if I'm being too extreme, but it's kind of like we've been in quarantine for this long, and now we're going back and we have nothing to show for it. We have no vaccine, we have no medicine, we have nothing. It's kind of like we're out in the front lines, and we don't need to be. We are a luxury business. We are not a necessity right now for people. I love that our clients are calling us and they want us, and we are trying to keep our business afloat, yes, but as of right now, we have a little bit of help from the government in the fact of like rent and things like that. So if they take that away and we go back to work and we get sick, then we can't really do our job, and now we're really in the hole with our business.
Well, we appreciate
so that's just really my comment.
we appreciate that comment, and we know it's a big challenge. I think that's kind of the point where the policymakers are struggling with that balance of the economic health of our state and community with the health of our residents, and it's a tough balance. So, but remember, you do not have to open. This is for those who want to open at kind of the earliest that's allowed by the local health jurisdiction. So,
but with that, I would like to piggyback that with one of the questions we received on the chat function, and that's in regards to code enforcement. And we have Israel Del Toro on the line with us today. Israel, what do people need to do if people aren't following the guidance or people are noticing that businesses aren't complying? What is the recommendation? And actually, maybe Israel dropped off the line, but with that...
Michelle, can I say something really quick?
Can you hear me now, Michelle? Michelle?
Yep, go for it, Israel.
Yeah, so if someone observed that there was a business operator that wasn't in compliance with the guidelines in place, it would be recommended that they contact 311, or they could also access the Citizen Self-Service Portal via the city's website and report that complaint. We respond to those complaints next business day, and in some cases that same day. And at that point, when we make initial contact with the business operator, we will educate them on what those requirements are, and then at a later time, we would be following up to ensure that they're meeting those requirements.
Thank you, Israel. We're going to go to our next caller. It's Alexis Dia. Go ahead and ask your question.
Hi. I actually also put this in the comments. I just wanted to ask if you could talk more about the face covering.
Alexa, if you could speak a little more loudly, please.
Oh, I'm sorry.
Yeah. Thank you. A little better. Go ahead.
Is that better?
Yeah, thank you. Go ahead.
Oh, okay. So I wondered if you could talk more about the face coverings required in salons. I'm a hairstylist in the city of Pasadena, and a lot of the stylists that I work with have purchased face shields. They think it will be difficult to communicate with clients and breathe easily with a mask on. So are face shields only, like a stylist, the client would wear a face mask, but if a stylist wears a face shield only, is that within the guidelines? Or if a stylist also wants to wear a face shield, do they have to wear a mask as well? If you could clarify that, that would be great.
Thanks for the question.
Yeah, that's a really good question. Actually, just the other day, somebody asked me that about a retail business where they have very close personal contact with their customers in the dressing room, and they were asking about face shields. I cannot answer the question right now because I don't know the science behind the way that a face shield would protect or prevent respiratory droplets from being dispersed into the air versus a face mask, but I can ask our health officer to weigh in, and then we could look and see if there are any studies comparatively to see if there's a comparable protective level, and I'll definitely consider that when we're writing the guidance, knowing that that is a preference for some.
So face masks are required, but the shield is something that is certainly optional and just not in the guidelines at the moment.
At the moment.
Yeah. Great. Thanks for the question. Next question. And just looking at the clock, we might just be able to take one more question as we end at least the target is noon. And before we hit that, again, comments in the chat function we want to encourage, because that helps us as we're writing our guidelines. We kind of see the questions and comments, ideas that you have. So please, we will document that in the chat as well, and in the website that I mentioned before. So Michelle,
yeah, let's go to Michelle Blemmel. Go ahead and ask your question.
Good morning, Michelle.
Hi, this is Michelle. Thank you. I had the question in regards to submitting the plan to the health department. So that was just one for me, that whether or not we would have to do that. So you've answered that. Thank you.
Great. Yeah.
Thank you. Let's go to John. He's raising his hand. Go ahead and ask your question.
Good morning, John.
John, go forward with your question. I have a question from one of the chat participants, and she's asking, I know winter is a little far off, but can they use heaters since heaters sometimes trigger coughing?
There's no restriction for heater use. So yes, you can use heaters.
And if somebody starts coughing in the salon, can they serve them water?
The way the guidance is written, my interpretation is that if you had bottled water for your customers, that you could distribute that.
Great. So we're at 11:58. Are there any closing remarks that you guys want to share?
Michelle, I would like to, just to, the caller a few minutes ago was, asking about, kind of like the risk level and whether or not, that opening these activities could potentially lead to infections among the staff. I think it's really important for everybody to understand that what we're doing across the state in public health is evaluating these readiness criteria to determine a baseline level of what we're seeing in our community. So really assessing our community conditions and understanding whether or not we have the capacity to identify new cases and then also to respond to it appropriately through medical resources. So that's the first part. The second part is a lot of these, to a great extent, a lot of these activities that are being opened up by the state and through the stages are being opened up based upon an assessment of risk of infection. And so all of these measures, all this guidance and protocols, they're all an attempt to mitigate the risk of these activities. And so we wouldn't be open to easing these restrictions if we didn't feel that the risk was okay enough at a low enough level for us to do so. And then I just want to add one final point, which is we are monitoring conditions on an ongoing basis. So if we do see an uptick in infection cases, we have the capacity to do contact tracing and case investigations so that we can quickly identify where is the source of the infection. And that's the way that we would identify which activities might be, basically what's contributing to the uptick. And then, of course, we could address that through restrictions on future activities. But I just want to assure everybody that this is not haphazard. This is very method, there's a method to it, and that we're really trying to do everything we can to protect the public while at the same time opening businesses as quickly as possible.
Great.
Great. I do have two more questions. One is with regards to glass separation. Will the city require any permits for that to do any sort of interior work?
Yeah, I mean, the glass divider still needs some kind of connections to ensure safety. So I think the glass provider should kind of know that threshold question on how big it can be before it triggers a permit. So I don't think we're eager to require permits, but there's still some safety on that front as well on how those things need to be bolted and secured. So I think the glass contractor will have that answer.
Great. And let's go to Amber Olivas. She's raising her hand. Go ahead with your question.
Hi, Amber.
Hi there. Can you hear me?
Yes, go ahead.
I was just wondering, so I know right now we're mainly focusing on the hair salons and barbershops, but can you tell me where do lash extensions fall into everything?
So my understanding, the way that the reopening stages are set out on the state's website today is that lash extensions would fall with the other personal care services, such as tattoo, microblading, scans, massage, and those would all reopen in stage 3, which is, and we're in stage 2 right now. And I'm sorry, but I'm not able to provide a date.
Great. All right, well, with that, we want to thank all of those who have participated this morning. Hopefully it's helped you a bit. We recommend you stay alert to the news that's coming out at the county level, checking out the state's website, but also looking at the city's website for items that are more specific to our community. We want to thank you for kind of just being in business in Pasadena. We know there have been struggles, but we're all hoping to get to at least a new normal and to get businesses underway and for everyone to be healthy. That's the most important thing. So stay tuned. again, look at those resources, and thanks again for your participation.